So the question is, should I have my gallbladder removed? The short answer is that if you're having symptoms that we think are coming from the gallbladder, then the short answer is yes, that the gallbladder should generally be removed. But let's look at that a little bit more deeply. The gallbladder is a small organ that lives right underneath the liver on the right upper abdomen toward the center, and when it starts causing trouble, it can form sludge or debris or stones. And during that process, it can create pain, and we usually experience the pain here in the mid-upper abdomen, but sometimes around the right upper quadrant and wrapping around to the back. But it's also called the great mimicker because sometimes people can experience chest pain, gaseous, bloating symptoms, and many other symptoms that aren't initially easily identifiable as coming from the gallbladder. Tests that show gallstones would be an ultrasound scan is the best one. Sometimes the stones can be detected on a CT scan or other studies, but those are not the best studies to look for stones. And secondly, a study called the HIDA scan, which is a nuclear medicine study in which we drink a contrast material that's labeled and passes through the liver and into the gallbladder, can indicate whether or not the gallbladder has developed inflammation or whether it is simply not functioning properly and it's not squeezing effectively, a condition known as biliary dyskinesia. If any of those tests are positive and you're having symptoms that sound at all like they're related to the gallbladder, then it usually is best to get the gallbladder removed. Pain, nausea, bloating, cramping, discomfort in those areas, particularly after eating and drinking, those are the most consistent signs and symptoms. Most of the time, the reason for being proactive and removing the gallbladder, there are really two reasons. One is it's much safer and simpler to do it on an elective basis. It's normally an outpatient, minimally invasive procedure. Takes about 30 or 45 minutes and people go home the same day. And waiting can sometimes lead to severe complications of the gallbladder, such as severe cholecystitis, severe infection, or other conditions such as pancreatitis. And sometimes those conditions, which result because of the delay, can require a big hospitalization and a more serious illness, open surgery, a longer recovery. So it's better generally to be more proactive and remove the gallbladder electively. The second main reason is that we don't generally need our gallbladder. We can live without it. A small percentage of people will have a side effect of some diarrhea or looser stools after the gallbladder is removed. But generally everybody else can eat and drink just about everything and live a long and normal lifespan and healthy life and enjoy a wide variety of foods and drinks without any special restrictions. So in sum, if you're having any symptoms that sound suspicious for coming from the gallbladder, it's a very common illness. It's a very common problem. It affects men and women, old and young, although it's more common in females and it's more common as we age past our 30s and 40s and 50s. But if any of those tests are positive, showing that there are gallstones or there is an abnormal HIDA scan, then it's better to be proactive, seek out a top-notch surgeon who does minimally invasive gallbladder surgery and have that gallbladder removed on your terms, more on an elective basis so you don't wait for the complications to set in.